Good morning, everyone. My name is Dr. Jodie Guest. I'm an infectious disease epidemiologist, professor, and vice chair of the Department of Epidemiology at Rollins School of Public Health at Emory University. I lead Emory's COVID-19 outbreak response team working in hard-hit communities across the state of Georgia. And I am happy to be the host for Emory's COVID-19 Facebook Live events, where we cover topics about the COVID-19 pandemic. Today, I'm pleased and honored to be joined by Dr. Carlos Del Rio. Dr. Del Rio is a distinguished professor of medicine, of epidemiology and global health at Emory, and is the executive associate dean of Emory University School of Medicine at Grady Health System. Dr. Del Rio is also the co-director of Emory's CFAR and the foreign secretary of National Academy of Medicine. As an infectious disease physician, he is an expert on COVID-19 and is also an investigator in Moderna's clinical trial for the COVID-19 vaccine. Dr. Del Rio is also the most recent 2021 recipient of the Charles R. Hatcher Jr. MD Award at Rollins for Excellence in Public Health. Good morning, Dr. Del Rio, and thank you so much for joining me.
Good morning, Jodie. I'm here in Atlanta. You are up in Alaska. Tell us about that.
Yeah, I am in Alaska. So we're going to talk today about what I'm doing up here and some of the work you've been doing. Just a year ago, I was on the Alaska Iditarod Trail, so the Iditarod Snow Dog Trail Race, when COVID-19 started breaking out. And we did a big pivot during the middle of this race to be able to keep all the villages and all of the volunteers who were involved in the race safe during COVID-19. A year later, we're here and we're doing the race. We start on Sunday. We're going to be talking about that today. I know that you have some experience with some sporting events a year ago that changed. We're going to hit those as well. So first, let's put some numbers in place. What we know is that we've just hit the 1-year anniversary of COVID-19 cases in the state of Georgia. Again, we're going to put this into some context of some sporting events and what was going on a year ago that Dr. Del Rio and I were both involved with. The US has now passed 29 million cases of COVID-19, and more than 530,000 people have died in the United States in the past year of COVID-19. For the past 3 weeks, however, the US has seen declining numbers, although slightly plateaued in the last 5 or 6 days. In the past week, 21 cases have seen falling numbers, 25 states have had numbers that are flat, and 5 states have increasing rates of COVID-19. Regionally, we still see cases the highest where Dr. Del Rio is right now in the southern states in the United States. Where I am right now in Alaska, things are doing pretty well, and we're actually leading the country for vaccine rates. But across the United States, there are almost 54 million people who've now received at least 1 dose of an mRNA vaccine for COVID, and 28 million people have received both doses. We've just passed the 20% of all adult populations vaccinated threshold, which feels pretty remarkable. So let's take a moment and pause and talk about that, Dr. Del Rio, before we hit our sporting event conversation.
Yeah, no, it's really remarkable, right? I mean, a year ago, I would have never predicted we would be, having close to 30 million Americans, over 500,000 people dead. And that devastation is just something that I would have never predicted a year ago. But I also would have never predicted that we would have had vaccines and we would have a vaccine rollout the way we have it right now. So I think there's a mixture of good news and bad news, but I think overall, I want to have cautious optimism right now. I think that we are in a good place, but it's a very treacherous place. We need to be careful. This is almost like, since we're into sports analogies, we're in the 7th inning and we're winning by a couple of runs, but the game's not over, and we need to be sure that we finish the game and we bring our closer and we do the right thing. And the time is not the right time to let up. I'm very concerned about 5 states who have lifted mask requirements, who have said everything is open, it's back to normal. Texas, Mississippi, North Dakota, Montana, Iowa. I think it's not the right time to do that. And I think with the variants and everything happening, we potentially could be getting in trouble by doing that.
Yeah, I could not agree with you more. And even if your states have lifted your mask mandates, it doesn't mean that you personally need to stop wearing them. And we're urging you to continue to do so.
No, I tell that to people. It's up to you, right? It's up to you to wear a mask. It's up to you to continue socially distancing. It's up to you to take care of yourself and your family. But it's also up to you to get the vaccine when your turn comes. It's really up to you. So when people say to me, when will this epidemic be over? I say it's up to you. It's up to all of us.
Absolutely. I like the way you put that. Let's talk about a year ago what you were involved with sporting events, and let's contrast your sporting events last March and mine. I'm not very athletic myself, but involved in a couple of sporting events. And so, what were you doing last March, and how are you helping the NCAA?
So it started with a call that I had from then Emory president Claire Stirk, who said, we have somebody in our board who's very involved with the NCAA, and they would like some advice because the Final Four tournament is going to be here in Atlanta. So myself and my colleague, our friend Colleen Kraft, got involved with them, and it was very early. It was March. It was early in the pandemic, and still trying to decide what to do. But at the end of the day, we decided that it would be on. Initially, we talked about having the tournament, but no public. And then eventually we went on, and I still remember the date. It was March 7th when we pulled the trigger, and we recommended. Our recommendation was that the tournament be canceled. And of course, we don't make the recommendation. We don't make the decision. We made the recommendation. I went to the NCAA board, and that decision was taken. And obviously, that was a huge decision. The NCAA Final Four tournament has never been canceled, and that had a huge also economic impact for Atlanta, where the tournament was supposed to take place. Since then, I have remained involved with the NCAA. We meet weekly. We have an advisory board that is now much wider than just a few people. We meet weekly. We talk about different things, and through them, I've learned. I'm involved in advising essentially all college sports through the NCAA and trying to make guidelines. Remember, the NCAA just is in charge of the tournament. So this year, the Final Four tournament for men is going to be in Indiana, and working to make it happen, and going to create a bubble to make it happen. And the Final Four women's is going to be in Texas. So we've been very busy trying to make sure that we can have this college tournaments, but do it in a safe way.
So if the tournament is in Texas for the women's, are you going to require masking?
We are, and this is where it gets interesting, right? Because even though the governor has said there's no need and everything is open, the Alamo Dome belongs to the city, and the city can make that decision. And once you're inside, the NCAA makes the decisions. The NCAA controls the ticket sales and everything. So we're going to control the number of people that can go in, and we're also going to tell people what they need to do. And if they don't do it, they can't come in.
Very good. So at what point in time do you make a decision that things need to pivot? Is this a constantly evolving conversation about what's going on with these events?
It's a constantly evolving conversation. If you go to the NCAA website, you'll see the documents and sort of the guidelines we put together. I think in a year we'd learn a lot, right? We're in a very different place. We have testing. We have a lot of testing. We know what kind of testing we do. So we are, doing testing. We've learned a lot about, how to run bubbles like the NBA did. So I think we've learned enough to be able to run this kind of things in a safe way. Now, we don't control the bars. We don't control the restaurants. So what happens outside the tournament? It's always the big question, right?
Absolutely. So a year ago, I was up here in Alaska. The Iditarod dog sled race is a 1,100-mile dog sled race. And so it was already underway on March 7th, the day that you were making the decision about the NCAA Final Four. And right around that same time, we had a conversation about, do we stop the race? But we had about 70 mushing teams, which is 70 times 16 dogs, out on the trail. We had about 500 people at different villages, 23 different villages across the state of Alaska, ready to support and care for these dog teams. It was about 70 veterinarians and a bunch of other volunteers. And the decision was, could we stop this race while people were trekking, hundreds of miles across the state of Alaska on dog sleds? And the decision was, we couldn't figure out how to stop it and get all those teams out of there without them mushing somewhere. And so the race continued, but we started moving all the checkpoints out of villages into standalone buildings so that we wouldn't have any contact with villagers. One of the things we had going for us at that point in time in the race is we had started the race when there were 0 cases of COVID-19 in the state of Alaska. So we felt pretty comfortable that we didn't have anyone on the trail who had COVID-19, but we also were really concerned about the optics of continuing, but also just the logistics of how you remove that many people by bush planes out of villages. So I'm back this year, and like you, every week we've been meeting to talk about how do we do this safely, and that starts first with the question of can we? And if the decision is that there's a possibility to do something safely, how do you do that? And so we've made lots of decisions, we've pivoted a lot, but we've built on all the knowledge that we've all gained from the science community in the past year, including work you've done with the NCAA and work that you and I have done with the Atlanta Opera, the Atlanta Symphony that you've worked with, et cetera. So masking is a huge part of what we're doing here, but we've also done a lot of testing and have worked hard to, again, like you've said, create a bubble where people have been tested sufficiently that we believe that we have a completely negative group of people who don't have COVID-19, and they can then function together, still socially distanced, still wearing masks, but do so in a safe way.
Yeah, the other tournament that I was involved with is the US Open, the US Tennis Open. And I was very involved in advising them about how to do it and how to do the testing. And, we had a successful tournament. It was a tournament without public, but it was successful. We did not have any outbreaks. We tested a lot. We had different tiers of people, and everything was done very carefully, but it was very successful. And again, a lot of it depending on testing, and a lot of it depending on also getting the players and their teams to agree with many things. And some of the players just simply didn't agree, and therefore they didn't play. They had to stay at a specific hotel. They had to do certain things. They couldn't go out to restaurants in the evenings, et cetera, et cetera. So a lot of sacrifice and compliance, but we were able to do it. I've been very pleased to see, what the NBA did. That has been terrific. The NFL was able to complete its season. I was concerned that, quite frankly, the winner of the Super Bowl was going to be the team that had less infected individuals, but they were able to do it fairly well. So I think we're learning a lot about how to incorporate testing into what we do. And I think that, we need to really start thinking about how do we vaccinate our athletes and our entertainers, our performance, soon as more vaccine becomes available, because it's really very important for society to have this kind of things. I mean, I feel terrible, for example, for our college athletes who are there and have very limited time to compete and very limited time to show, and that may determine their career and to perform. And we got to make sure that they have that ability and we don't cancel a tournament.
So in addition to testing and masking and social distancing and making sure people are in a negative bubble, do you think there should be priority for vaccinations for athletes?
I honestly think so. And I think that the priority is once we have a little more vaccine, but vaccines pretty soon are going to be readily available. And I think at some point in time, we need to do two things. We need to make it easy for people to get a vaccine. And we also need to make special efforts to make sure that those disenfranchised get the vaccine. It's almost like I was talking to somebody, like we did in Georgia and get out the vote efforts. We need to now get out the shot efforts, right? We need to be out there to really vaccinating those that are less likely to have access to the internet, to have a car, to come over. But we also need to be sure that we provide easy access to vaccine. I get very frustrated, for example, after talking to a nurse on the floor who finally decided that she's going to get a vaccine. And then I tried to schedule an appointment and you can't find one. We need to be sure that we make it easy. So the moment the person makes the decision, we vaccinate them. My friend and colleague, Kimberly Manning, who is superb at giving examples, she says that it's a little bit like we're trying to convince people who are afraid of heights to jump out of the diving platform. And we finally convince them and we get them to the edge of the platform. And then we say, no, wait a second. You got to wait until there's water in the pool. So just hang here for a little bit. Mm-hmm. It's very hard to do that. As we're talking to people and as we're trying to address vaccine hesitancy, we need to make sure that it's easy to get vaccinated.
Could not agree with you more. With Johnson & Johnson's vaccine being FDA approved for emergency use authorization this past week, we should start to see more vaccines be available, including some that are easier to administer. Absolutely.
And I think a single dose vaccine is very good. I think that, people are making comparisons that are unfair, whether it's less of an effective vaccine compared to the Moderna or the Pfizer vaccines. I think it's, Bob Walker this morning in Twitter said something that I think is a great example. He said, it's a little bit like, again, we're talking sports, a little bit like golf. You can't compare the shot of somebody who shot early in the morning with no wind and a good temperature to the shot of somebody who came in later in the afternoon. There was a lot of wind, and therefore they didn't do as well. They're both excellent golfers, but the conditions change. I think, the way the vaccines were tested were very different. And I think that a lot of the results have to do with that.
Yes, I agree. And I like the fact that you continued our sports analogy today by using that one.
This is sports meets Emory COVID response, right?
That's right. Exactly. So as you and I've worked on some of the larger sporting events that are happening in the United States, or this Iditarod trail race is an international race. Let's talk a little bit about high school sports. What do you think should be happening, and how can we all be helping our high school athletes stay safe and compete?
Well, I think it's pretty much the same thing, right? We need to be sure that we establish guidelines about masking and other things. We need to be sure that we prevent outbreaks from happening. And more importantly, we need to be sure that we try to keep them safe by doing, I think when people get in trouble, I worry less about what happens in the court. I worry more about what happens in the locker room. I worry more about what happens, when you put, the other day we were talking, for example, with the NCAA about wrestlers, about, the fact that they, after they finish competing, they all go in the locker room and they take showers. So how do you schedule them in such a way that you can't tell them, get in the bus and go to your hotel to get showered? How do you allow them to shower, but don't have, 6 people in the locker room at the same time, which is a very small locker room? How do you arrange it? What are the logistics behind that? So I think, working with schools and working with parents, you can safely have sports happening.
And let's talk for a moment about the impact of the mental health impact that we've had from this COVID-19 pandemic in the last year we've all lived through. Should we be prioritizing some planning groups to work with our student athletes and our entertainers and those who are, performing concerts and things like that? Is that good for all of us, for our mental health?
I think it really is. It really is also for the performance. I've working with the Atlanta Symphony, with the Atlanta Opera. I also got the opportunity to work with the Chicago Symphony at some point. It makes a huge difference for those people that their life is to perform. It makes a huge difference once they can get on the stage and they start performing. And then for those of us on the other side, the ability to watch them. So even though I can't go to Symphony Hall, the fact that now the Atlanta Symphony is available through the web has had a much greater number of people watching them than ever before. So we also are reaching a broader audience. And, I find music, I find sports are incredibly important for the soul. Again, it goes back to what Winston Churchill said during the Second World War. If we're not preserving the arts, then what are we fighting for? Right? There's culture. There's an important component of what happens in society that is so linked to the arts, to entertainment, to sports, that to me it's really important that we preserve that.
Yeah, and I think that each of the examples that we're using, the Iditarod, the NCAA, the Atlanta Symphony, Atlanta Opera, Chicago Opera, or Symphony, excuse me, none of these events are opening in the before times. They're not opening as they used to. They've all made changes. They've all had to pivot. They've all had to make some big decisions. Here, we normally have a big mushers banquet. There'd be about 5,000 people there, while the mushers, the people who drive the dog sleds, thank their sponsors, they get their bib number and things like that. It is a lovely event, but it's an event that didn't need to happen in order for the race to occur. And it's an event that was bringing people together that we weren't able to keep in our bubble. And it was a way for our bubble to not stay safe. And so you have to make some decisions about some of those things can't continue. in our current state, but that doesn't mean the entire race has to stop. Other parts of it can continue. And so this adaptability, I think, is what we're really trying to get at. Is it's not a yes, no, things are the way they used to be before, or they can't happen. There are some ways to adapt things and have them move forward.
Absolutely. I think about the creativity that we did with the Atlanta Opera, where, we moved it outside in a tent.
Mhm.
We had, pods of individuals, that were sitting in certain places. We had everybody masked. We had those plexiglass boxes where the singers that were going to be singing unmasked were inside. I mean, all those different things to try to decrease the risk as much as possible. And now, for example, for this season, we're doing testing. We were able to get from the state a BIMAX now test, and we're literally testing every performer, twice a week, and that makes a huge difference.
Right. I remember as we were talking about the Atlanta Symphony, the costumes are a huge part of the opera. And how do you help performers change their costumes when it normally would take a bunch of people to do that in a way that would be safe? And, individual dressing rooms and an individual dresser became part of the plan as well.
Absolutely. But, we also have learned from healthcare that, we're with patients all the time. And if we are with our PPE and we are careful, we don't get infected. So there's things to be learned there.
Right. What do you think about as we think about small groups? And I'm thinking specifically about the way the Atlanta Opera was set up, where people would come, you had small tables that you sat at that weren't more than 4 people. You had a health screener that you filled out before you got there. And then there were temperature checks. Do you think temperature checks need to stay as one of our consistent prevention and screening methods as people arrive at events?
I used to, I don't anymore. I think that temperature screens they're useless in the sense of picking up somebody. I think they're important in the sense that it provides a stop and it just reminds people that something is happening, that we're being careful. So I have this mixed feeling of, it's almost like putting a scarecrow. It doesn't do a lot, but it does do something. It reminds you that something is happening, something is still going on, that we're not in normal times. So call it a temperature screen, call it a health screen, call it a way to create a sense that everybody needs to think about it on a regular basis. And most importantly, is to remind people, if you're feeling sick, if you have a temperature, don't attend any events, stay home and don't go out.
Right. What are your thoughts about attending events? So I know we've helped plan events. I'm obviously here in Alaska and will be part of the race and out on the trail. But what do you feel about walking into a stadium? Would you be willing to do that right now?
I went to the opera and I went to the Atlanta Opera. I thought it was safe, and I thought it was also important for me to be there. I think I would be okay going to a stadium with limited capacity, and especially, and being masked all the time. I would certainly not take off my mask, and I would still want to be in sort of a pod, let's say, next to people that I live with or I'm with, and everybody is masked. I don't want to be sitting right next to somebody who's not masked and screaming. But I think there's ways to do it and to keep social distance, and there's safe ways to do it.
Does it remain important for us to keep track of who is at these events so that for contact tracing? Is that part of some of the plans you've been working on?
Well, some of the most recent plans are actually looking at how you ensure that people that are coming into those events are vaccinated, right?
Mm-hmm.
Because, for example, this weekend we have the NBA All-Stars game here in Atlanta, and the people are going to be in the stadium. Emory Healthcare is giving tickets to people who have been fully vaccinated. So at some point in time, I think being vaccinated is going to be almost a requirement or some sort of a passport to be able to go into this kind of events. And I've been talking to the Atlanta Symphony. A lot of the clients of the symphony are people over 65. Many of them have been vaccinated. Could you have, certain days that you say today, the Saturday performance is only for people who are vaccinated?
Right. So let's talk for a moment about some performances that are perhaps easier spreading events of COVID-19. We know from some early outbreaks in this pandemic that singing and some instruments are actually a pretty a great way to spread COVID-19 in a closed space. With the Atlanta Opera, every singer was behind a plexiglass, a 3-sided plexiglass wall in order to be able to sing, and they were separated on different stages. No singers shared a stage. What do you think about chorale and choir performances?
Yeah, I mean, I'm still nervous about chorus. I still think we need to be. I'm not ready to have chorus performance, and as you know, for the Atlanta Opera, the chorus was all streamed. It wasn't live. I still think that chorus is a challenge. We know that it's one of the most highest risk activities, and but I think we will start figuring out, right, how to be able to do it. And I think chorus will be one of the ones that I would put as one that I worry the most about.
Okay, and to me, as I think about the court, I agree with you. And as I think about singing being an easier spread opportunity, that also makes me concerned about people who are cheering loudly and unmasked at events. It's the same sort of
mechanism, right?
Yes, exactly. So masking, is that sufficient? And can we help everyone remember that we can still cheer behind our masks?
Yeah, I think masking, but again, you go to this whole issue that you have to wear a mask correctly and it has to be the right mask, right? Mm-hmm. I've seen too many people wear things that are not masked and don't wear it appropriately. And, so many times I still see people on the street that, take their mask when they're getting ready to speak on the cell phone. And I'm like, excuse me, but that's when you need to keep your mask on. You're opening your mouth.
Exactly. It's amazing how many people you still see pulling their mask down in order to talk to someone. And I think we're recognizing that it's so much easier for us when we see in a person's entire face, but that's not keeping the people that you're near safe.
One thing that I think is worth talking about is, probably today or maybe pretty soon, but maybe today, CDC is going to be issuing guidelines about what is safe for people who have been fully vaccinated to do. And I also wrote about it in a viewpoint that I published in JAMA yesterday. And I sent it to my colleagues at CDC who said, oh, looks pretty similar to what we're going to be talking about. So I'm kind of looking forward to seeing that guidelines. But, CDC has said a couple of things, and I think it's important that we start talking about what are the benefits of vaccination. And, one of the benefits is you don't need to quarantine after you've been exposed. Number two, you can have small gatherings of fully vaccinated individuals without masking. So there's certain things that I think we're beginning to get a little more comfortable. I tell people, when I used to get on a plane, I used to wear an N95 and a face shield and be incredibly careful. I'm still careful. I'm still wearing a mask, but I'm not wearing an N95 anymore. And I'm not wearing a face shield. I still wear my glasses, but I think there's I'm a little bit more relaxed, I would say, even though I'm still careful. And I think that's something that we need to start educating people and telling people, because it makes no sense to tell people get vaccinated and everything is just as it was before. Because then you hear people saying, so what's the benefit of vaccination?
Right, exactly. So I think to summarize what we're talking about is there are ways for events that we hold dear and important to start to reoccur. They may look different. They may have pivoted in ways that are unexpected and in ways that may need to continue to pivot as it's going on. I'm anticipating during this race that starts on Sunday, we're going to have multiple decision points where we need to make, we may need to make deviations from the best laid of plans, but it is our time to start considering how best to do things together and gather together, particularly if you're vaccinated.
I think we haven't talked about, but one big decision that I still have not seen being made is about the Summer Olympics, right? And I still have doubts that it's going to happen, but I think it could probably happen. Obviously, it wouldn't be your typical Olympics. It'll be a little different.
Right. Everything's pretty different these days. So.
But the good news is, honestly, we have television, we have the internet. As I said, I've been able to continue watching the Atlanta Symphony, not inside the hall, but in my television. So, I was able to attend the US Open tennis tournament, not in person, but on my television. So I think we need to continue also seeing that if those things continue to happen, we can still follow them.
Right. Right. And you actually have better seating from in your own home than you do at events, right?
Well, it's always fun to go to events, but
of course.
But again, you have to be again, you go to this whole point that we don't need to close absolutely everything.
Right. Right. And as we look forward to the CDC guidance coming out about how vaccinated folks can get together safely, that's going to need to be exciting guidance. And thank you for what you wrote about it as well. Dr. Del Rio, thank you as we close today for all the work you've been doing to help keep people safe in the NCAA, the US Open, the symphonies, the operas, all of these things that are cherished events in our community. So thank you for your work with that and helping bring all of those to us.
Yeah, well, thanks again for everything you're doing. And let's keep vaccinating. Let's keep wearing our mask, and let's end this pandemic. I'm looking for the end of COVID, and it's up to all of us to make it happen.
Yes, it is. Thank you so much, Dr. Del Rio. Everyone, please stay safe. Please continue to wear your masks no matter where you live. Please make really great decisions about your community and how to move us out of this epidemic and this pandemic together. Have a good afternoon, everyone.